Good morning, good afternoon, or good evening, depending on where you're tuning in from. My name is Shapiro, and I'm here to welcome you to the 12th Global Forum on Nicotine Conference, coming to you from Warsaw. So this is the 12th year. I've been coming for 10 years, so I've been coming here since 2015, which is really where I started to get involved in the tobacco harm reduction space. All the conferences I've been to have been exemplary, both in logistics and in content. But I'm particularly interested in this one because it's all about communications, which has been my sort of stock in trade in drugs, HIV, and more recently, tobacco harm reduction for over 40 years now. But we know in 2025 about the challenges of communication around communicating the benefits of tobacco harm reduction to the wider world, to professionals, politicians, and the media. For those of you who are going to be sticking with us, we have a really top, best of the best, really, people coming to speak here about the challenges of tobacco harm reduction and hopefully some of the ways of either getting over the hurdles or swerving around them. Talking about the best of the best, I'd like to introduce you to the commentary team that are sitting here. Over on my far right, we have Marcela Madrozo from Mexico, who represents Promoting Health Without Frontiers. We have Gabriel Oki from Nigeria, but resident in Liverpool. And he's a Liverpool supporter, Paddy, by the way. He's a public health researcher with a special interest in, well, I'm sure he's got lots of special interests, but one of them is tobacco harm reduction communications and public health messaging. And Will Godfrey, who many of you will know, editor of the esteemed Filter magazine, where truth and justice meets harm reduction. There you go. Mm-hmm. There's a slogan for you.
Giving me that tagline for free.
Yeah. No. You can pay me later. So let's start off with Marcela. I mean, you've come all the way from Mexico. So kind of what apart from the possibility of getting a free pen and a nice bag, what brings you all the way here to GFN? What are your kind of hopes for the conference that focuses on communications?
Well, thank you very much, and good morning to all of you. As you know, in America, we have a lot of challenges. And one of the challenges we have to confront better is how to communicate with our population. And when I talk about population, I mean which population, because the message cannot be the same one to everyone. Right. The message to young people cannot be the one that we want to send people that want to quit smoking, for instance. So what are the messages that are working, that are targeting the population we want to reach? What kind of new messages should we send to the population? Because we've talked about THR for a long time. We've talked about how many people die because they consume tobacco, how many people die in each country, how many people smoke around the world. But this has been said so many years. Mm. We have to be fresh. We have to start with new messages. Right. And something I expect is to learn what is working in other regions of the world. Right. What type of messages are being make us able to reach the population we want to reach and give them the message we want them to receive. Right. That's what I would like to, and I'm sure I'm going to learn a lot during these 3 days.
Thank you for that. Okay. So, Gabriel, what about you?
Okay, so now I'm really excited because I work in health communications. Since my undergrad, I've been working, in health communications, writing articles, working on newsletters, social media communications. So when I left uni, I was like, okay, I wanted to do something very novel. And then I realized, tobacco harm reduction doesn't have enough research, and enough communication.
Right.
You don't see enough about it online. And that was why I joined the Tobacco Harm Reduction Scholarship. And since then, I've been coming. This is my fourth time. And my fourth time now hearing that we're talking about communications, so I'm really excited. Right. I want to know what is working from even Will, who runs his own organization, learning from people what is working. Because as we all know in communication, you zone in on what is working. You keep iterating, and then you leave behind what is not working, and then you keep working on, on things that are working. So those kind of research combined with communication for advocacy is what I'm really excited about to this conference, to be fair.
Excellent. Mr. Godfrey, you've been here before, but I don't think we've had a GFN that actually does focus on what you do every day. So what particularly, I mean, you've had a look at the program, I assume. What kind of sparks your interest, do you think?
Well, I mean, I'm particularly thrilled with the overall theme of the conference to begin with, because to me, and not denigrating the really important work that people do in so many areas of this field, but communication is the absolute number one priority. Because with science, yes, there's always more that we can find out, but we have the basic knowledge in place about relative risks, about cessation, and the gap is that the public and of course lawmakers don't know it or refuse to know it. And so we have a situation where in country after country, majorities of people believe that THR products are as harmful or worse than cigarettes. And imagine if we could find ways to reverse that. And then it would not only see people changing their behaviors, as some already are in their millions, despite governments not deigning to permit or condone it. And you'd have governments that implement prohibitionist or restrictive policies suddenly realizing that those policies are wildly unpopular. And so that's... I don't know if that quite answers what you were asking, but that's why I think the theme of this conference is so important.
That's fine. You can ramble away. We don't mind. It's all very friendly and informal. No worries. No worries. So, Marcella, this kind of combines the two questions, really, because you come from a country which is not exactly tobacco harm reduction friendly, if I can put it like that.
Not at all. Not at all.
So, in terms of promoting health without frontiers, what are you actually doing? How does all of that work for you in Mexico?
Well, in the last 3 years, we've been engaged mainly in communicating what really THR means. What are these tools? How can they be used if you want to quit smoking? Because a lot of people in Mexico, this is something very important. The prevalence of smokers has grown in Mexico, despite FCTC.
Right.
All right? And it went down to 16.8% of the population. And after all the presidential decrees banning them, it went to 19.6.
Okay.
So as soon as they started banning it, even though you were able to buy them, because you could go to many places where you could really buy vapes, even though the prevalence grew. Now, what I'm trying to say is we focused on communicating through social media.
Right.
And we also worked and we had training with doctors, first contact doctors that can, because in Mexico, when we started, 77 out of 10 doctors thought nicotine was the cause of cancer and heart attacks, for instance. So you have to, how do you consider they're going to be able to advise their patients if they don't have the information or they have misleading information.
Right.
So we started to work with them, and we also worked with, we had workshops with journalists, because those are the ones that can help us send the message to their audiences.
Okay.
Okay, so we focused on that, and we also started working regionally. We did case studies of Argentina, Brazil, Costa Rica, Colombia, and we went there and we presented how is the status of tobacco control and THR.
Right.
And it was important because we had a lot of media when we did the presentation, so we were able to reach that population of South America and Central America.
Okay.
Now, what's going to happen in Mexico? That's a big question mark.
Yeah.
Because the Constitution says that any activity that has to do with vapes and electronic devices will be sanctioned. But they don't say how they're going to be sanctioned. Okay. They don't say they are banned or prohibited.
Right.
They said they will be sanctioned. But any activity, does that mean that talking about this in Mexico is going to be a sanction?
Yeah.
We don't know yet.
No.
Because the secondary laws have not been approved, and we don't even have a project of secondary law. We don't know how it's going to be. I mean, there's no project registered, nor even in the Senate or the Deputies' Chamber.
Right.
So we don't know how
You
it's
don't
going.
know. I'm going to come back to challenges
Yes.
in a minute, because that, for you, for Mexico, that's a big
It's a
one.
big challenge.
That's huge. Gabrielle, I know I've seen stuff online that you've written about media responses in Africa. I mean, I'm obviously particularly interested in Africa because for all sorts of different reasons, which I'll come back to. But what's been your focus in terms of tobacco harm reduction communications work?
Yeah, thank you very much for that question. So as I said earlier, when I wanted to start into research communications, I realized that there wasn't, you don't even have enough journalists, enough people talking about it. So I didn't have enough to even work with. Right. That was why I decided to organize a fellowship program when I joined the Tobacco Harm Reduction Scholarship Program. So to do a fellowship program and then recruit people who are interested in the topic, have discussions about it, and then experts come in, they talk about it as well. And then alongside, pre the fellowship and after the fellowship, collected data as well, and then look at the data, what was their knowledge before they joined the program, and then what was their knowledge. So that was how I got to publish the research you're talking about. And I realized that more than 70% don't even have proper knowledge of what tobacco harm reduction is. And these are emerging journalists, these are emerging public health advocates. More than 400 people were part of that study. So imagine 70% of these people who are going to become journalists tomorrow, who are going to be in front of televisions tomorrow, talking to people, not even having, full understanding of what.
And is that in Nigeria? Was that a study done in Nigeria?
Nigeria and
Africa generally.
Africa generally.
Oh, right.
So that was really concerning, to be fair. So and then I realized, there's something here because the knowledge gap is really huge. Okay. And then you probe further to know, where are you even getting the misinformation you're getting? I realized people are, lots of people who call themselves advocates as well, who just read something online and all. They just want to gather likes on Facebook and the likes on push anything out there. So when you are getting misinformation from other type of media, and then the real media, which is, not the real media, but your TV, your radio, and the likes are not giving you the right information, then there's a lot of problem in the future. So the gaps, knowledge gap, is where I'm really interested. Science and communication, trying to ensure that there's enough to drive advocacy, really. Yeah. So that's why I'm interested.
Thank you for that. That's really interesting. Will, how long has Filter Magazine been going?
We pushed it live in 2018, which was actually the first year I came to this conference as well.
Oh, right.
And we've been continuing ever since. Yeah.
Right. And the mission statement, if I can call it that, for the magazine is what? Because you don't just talk about tobacco harm reduction in your magazine.
Yes, so we cover and communicate about drug policy and harm reduction and related human rights issues in general.
Right.
But within that, tobacco harm reduction is centrally positioned, and that's something that was very deliberate in the concept right from the beginning, because how can you adequately cover drugs without covering the world's biggest cause of drug-related death? To me, it would be absurd. And so we're very proud to do that and to make efforts to integrate THR within the wider harm reduction and drug policy movement, where I think it belongs. And unfortunately, the two have often been siloed.
We'll come back to that one if we've got time, which I think we probably will, looking at the clock. So what kind of, I mean, presumably Filter goes global, doesn't it? Presumably you've got readers all over the world? Do you get?
Yes. Yeah. We, the biggest segment of our audience is in the English-speaking countries. United States top of the list, but all over the world. So yeah, we've generated a direct audience of millions, but also, of course, been picked up, republished, cited, blogged about in many other publications, including kind of national mainstream media in the US and other places. So hopefully our reach is bigger still.
Is big. Excellent. Okay, so back to some of the challenges which Marcelo you've already touched upon. I'm just thinking in terms of talking to journalists, talking to doctors, two things really. One, how receptive do you find them? And two, depending on what a definition of sanctions means, there's a potential that you just won't be allowed to. People won't be allowed to talk about this. This sounds weird.
We could go there. We don't know. We hope we don't.
No.
But we don't know. When the Constitution was reformed, the same reform said that the Congress had 180 days to publish, let's say, the secondary laws.
Right.
Now, this is going to, the 180 days are due next July 17. I mean, it's right now.
Right.
They should be approved by now. As I said, we don't even have a draft. We don't know of a draft.
Right.
So how is it going to be worth it? We have no idea.
No.
What we have also done, and I didn't mention it, and I think it's important, we had a weekly podcast. We have a weekly podcast. And we have experts there. Roberto Sussman has been there several times. And he explains in a very casual vocabulary so everybody can understand.
Which is difficult for
Which
Roberto.
is very difficult for Roberto. It's very difficult. I have to recognize he's been very good at it. And because, as you said, many people thought that THR was even worse than smoking, using THR devices. And many people think that the vape, the aerosol that comes out of the vape is even worse than smoke emissions. So he was there to explain, they're not the same, they're different, and of course you cannot compare the danger or the risk of one with another. But we also had people testimony of people that were able to quit smoking after 30 years of maybe consuming 2-3 packs a day, and they did it through vape and or electronic tobacco compressed tobacco devices.
Yeah.
But we also had families, children that said, my father doesn't smoke anymore. We don't have to be smelling the smoke. He doesn't smell like, so it's been very, very interesting.
Right.
And that's something we hope we are going to be able to
carry on.
Yeah. If not, what we are going to do is move to the region and have our broadcast and everything from another country of the region. And hopefully we could reach audience in Mexico, but we're not going to be doing it from Mexico. But it all depends on how the secondary laws come.
So there's no definition of what sanction means in Mexican law?
I mean, somebody even said that if you had a vape in your car, not even using it, just to have it. 36 hours of arrest. And 180,000 pesos of sanction. I mean, this is absurd.
This is
but
weird.
Somebody in the media started saying that this was, but as you go to the portal of the Congress, there's nothing there. Nobody has registered.
And nobody, you haven't, people who you might define as activists or others like yourself, have not been able to make representations to politicians or anything like that?
But what happens is that the ruling party has more than 2/3 of Congress under their control.
Oh, okay.
Okay.
Right.
So we have and there are doctors that are in Congress that feel that this ban is absurd. And, it's going to put at risk everybody because we don't know what the quality of the products you're going to buy.
Okay.
And what we are doing is strengthening the black market.
Yeah, of course.
And in Mexico, as you can imagine, the black market is in the hands of the cartels.
Yeah, of course.
So if anyone is happy with this, are the cartels, not the rest of the population.
No.
But what they say is we are going to go to Tribune.
Yeah.
We're going to win the discussion, but we are going to lose when they vote, when Congress votes. Okay, so yes, I'm not personally because I'm not at advocacy, but they're also saying, well, let's wait until someone registers a draft, and then we can discuss on something. Right now, we don't know.
I've got a lot less time than I actually thought I had, so I'm going to move very quickly. I was talking about public health messaging in Africa. I was talking to a delegate from the DRC yesterday over lunch, who told me that his country has got 100 million people. 75% of them haven't got any electricity. Most people live in rural areas. Very briefly, how on earth do you get public messages? Actually, about anything, but about this to people who don't know, haven't got mobile phone because you can't plug it in anywhere.
So it's
tough.
It's really tough, to be fair. I was also trying to build on what she said about the kind of communication. What you would tell a doctor when you're even trying to advocate about CHR is different from what you tell the journalist. The messaging itself. So I feel like to an extent we really don't understand how bogus the problem of communication really is, because it's like everything. While I was traveling on a plane, I was reading this book by Malcolm Gladwell, that where he did research on how Nickelodeon did some of their cartoons and all that. They were able to reach children and make them think about stickiness. He was talking about stickiness.
That's right.
And I was thinking about this conference, like, wow, we really need to do a lot of work. When I was looking at the robustness of the research in that area. So as you said, DR Congo is just one of the countries. Lots of countries like that in Africa.
Exactly.
Lots of countries.
Exactly.
So, even some don't even have television.
You have to be innovative.
So you have to be innovative, as I said. Okay. And then I think sometimes you now have to look at what is existing already. So I think a place like Rwanda now, they have a huge program around community healthcare workers. I wrote an article about it on Filter as well.
Right.
So you can now work with that. So if you are able to educate community healthcare workers very well, then they go into communities alongside other communication that they are doing. When they see someone smoking, then they can admit that already. I think so that's one way, because that is already working in a place like Rwanda.
Right.
In Nigeria, maybe you use the radio because whenever there is maybe a word tobacco day, what this day, or what that day, people always come on radio. So if people that are coming on radio on these days don't pass the misinformation and they are really saying the right things, then you are reaching people on radio, things like that.
Mr. God, I'm gonna leave it there because we've got a presentation later about the problems of integrating tobacco harm reduction with drugs and HIV harm reduction, which is a big issue. People who you would think are our allies are quite often not. So I'm gonna, where are we? Where's that camera gone? Right, we're doing this camera now. So there is an issue here which we didn't get to talk to, but there is a presentation at the conference about integrating drug, HIV, and tobacco harm reduction, because we should all be allies, and sometimes we're not. So thank you to my commentary team for a very interesting conversation. Have a good conference, everybody. My name's Harry Shapiro. This has been the first commentary team. And now we're going to switch over to the main hall for an opening keynote speech on why is everyone so terrified? What's wrong? Why are we all terrified about tobacco harm reduction? Well, we're not, but there are people who are. Thank you very much. Thank you.